Amanda with StraightSmile Solutions, and today we're answering all your orthodontic questions. We had an awesome question from our Facebook group about when you have braces, after braces, let's say you have a space, what should you use to replace the space? And this patient was thinking maybe you should go with a bridge, but I'm always gonna recommend an implant if you qualify for one, if it's a healthy choice for you. And of course, you're gonna wanna check with your prosthodontist or your general dentist to see if this is a good choice. It really depends on the health of your tissue, the health of your bone, and everything like that. But you can see the difference in this illustration between a traditional bridge and an implant. So a traditional bridge means that you're missing one or two teeth, maybe more, and the adjacent teeth, the ones on either end, have to be prepared. That means they have to be ground down to little nubs so they can support the bridge, okay? So it means you're taking two healthy teeth in order to replace one missing tooth and grinding them down. I know that seems like, oh, it's not a big deal, but over time this does become a big deal because bridges only have a lifespan of an average, I'm gonna say 5 to 8 years, could be less, could be more. Probably based on your diet, based on your habits, based on how well it's done. And over time, they're gonna either get decay around the edges, it's called recurrent decay, or they're just gonna break, wear out, and it's gonna have to be replaced. And every time they have to be replaced, the doctor has to re-prepare the abutment teeth. So they're gonna have to grind them down again, okay? And go lower, go more invasive, go smaller. Over time, you're gonna have to get root canals because you're gonna get closer to the nerve. That's gonna cost money. Over time, you might have to get crown lengthening in order to get the edges of it. That's gonna cost money and be painful. So, and eventually you're gonna lose those teeth and they're gonna need implants or a bigger bridge. So I don't recommend a bridge in most cases. I always recommend an implant. Now, if it was like my 90-year-old grandmother, sure, get a bridge, okay? Because it's a much quicker procedure. You're gonna get your everything done in a much quicker, you can get it done in a couple of weeks as opposed to a couple of months. So, and it probably is cheaper. So, but you know, if you're 10, 20, 30, 40, 50, 60, 70, 80, you know, definitely consider an implant. So that's my tip for you. For implants, I mean, it's a very specialized procedure. Every general dentist knows how to do a bridge. Not all dentists know how to do implants. So it's something you don't want to go to somebody who's only done a few of them. There's a few steps to making them. You want to go to someone that's done hundreds, if not thousands of them, ideally. So that's going to be, and sometimes it's a different dentist that places it as opposed to restores it. So you may need to work with a team of 2 dentists. There are some general dentists that do place and restore. So you need to find out, is your price just for the placement, the screw component that goes into the bone, or the screw component and the coping, the little area that connects it. There's like a joiner and then the crown on top. So there's basically usually 2 to 3 components that make up an implant. So you need to find out what the price is. You need to find out what happens if the first part fails. So sometimes they do. They don't take to the bone. They don't basically glue to the bone. So they're not glued, but they don't integrate with the bone. So if it fails, who's responsible for that fee? These are all things you need to ask. And remember, you need to go to someone who's extraordinarily experienced. You don't want to mess around with somebody putting something in your bone, causing permanent paralysis or paresthesia, permanent numbness, damaging other teeth. There's so many things that can happen. And, you know, if it fails and you have to get it taken out, it's a very invasive procedure. So again, do it right, do it once. And of course, you know, things are going to go better if you have your ortho first. So any questions, visit StraightSmileSolutions.com. Hopefully that answered your question. Bye-bye.